Hi, if you're a woman of childbearing age, you should be aware of the impact vitamin D deficiency can have on your developing baby in the womb. The Barker hypothesis is considered the first 1,000 days from conception to about the age of 2, and it describes what we call the fetal origin of adult disease. This was first studied back in the 80s in children that were small for gestational age due to various reasons. What scientists noticed was that they would go on to develop certain heart conditions. So what this theory talks about is that there are nutritional and non-nutritional stress during early development that has a profound impact for one's risk for developing future adult disease. Some of the associated chronic diseases linked to in utero fetal programming would be diabetes mellitus, obesity, asthma, multiple sclerosis, Alzheimer's disease, autism, attention deficit disorder, bipolar disorder, and cancer. You need to know that the fetus cannot make the parent compound of vitamin D, which is called cholecalciferol, and it relies on the mother's vitamin D, the calcidiol, coming through the placenta. What they've determined is that the optimal uptake of vitamin D in the placenta occurs when the mom's blood level is at or above 40 nanograms per milliliter. So from Wagner and Hollis, they say that maintaining a serum vitamin D concentration of at least 40 nanograms per milliliter at conception provides maximum protection from pregnancy-related complications such as preeclampsia in the mother and asthma formation in the fetus. Now, many women will need 4,000 IUs per day or more to achieve this level, but the only way to know if you have reached this level with your supplement is to have a blood test. There's no one size fit all in terms of supplementation level, and everybody responds differently. So the only way to know if you're reaching that optimal range of 40 nanograms per milliliter is to test. Okay, the main takeaways from this slide is just to illustrate in the upper corner with the bright sun that when your skin is exposed to UVB, which occurs when the UV index is at 3 or higher, that it converts this precursor in the skin into vitamin D3, which is called cholecalciferol. And that is the predominant form of vitamin D that we use in your body. 90% will be in the form of vitamin D3. Now, to the right, there are dietary forms of vitamin D. So we have the dietary forms coming from plants such as mushrooms, ergocalciferol, D2, which is not as stable as vitamin D3. But you can also get cholecalciferol or D3 from meat, fatty fish, fish liver oils. So these are all the inactive forms of vitamin D3. And through a series of steps, it will go to your liver and becomes the storage form of vitamin D, which is also called calcidiol, the 25-hydroxy vitamin D3. And this is what we measure in the blood. Once it leaves the liver, when it's needed in the body, it'll go to the kidneys where a second reaction occurs, and it turns it into the active form of vitamin D, which is called calcitriol. And that's where all the actions happen with the calcitriol. So just a brief definition of terms. So the vitamin D3 supplement, or what's made underneath your skin naturally when exposed to UVB, is cholecalciferol, and that's inactive. The vitamin D3 measured in the blood is called calcidiol, and that is also inactive. Now the placenta uses some of the calcidiol from the mother and transfers some of that to the fetus. Vitamin D3, the active form, is calcitriol. Now the placenta actually has a way to turn the calcidiol from the mother into calcitriol, which is the active form of vitamin D, and the calcitriol is used in the placenta to keep it healthy, and also some of it's transferred to the fetus to help the fetal development. So this is just showing a summary of vitamin D in pregnancy. So we see that during deficiency, there are increased rates of miscarriage, preterm birth, infections, gestational diabetes, preeclampsia. On the fetal side, deficiency influences fetal development, the brain neuronal development, neonatal immunity, asthma, psychiatric disorders. So summarizing vitamin D actions, it's essential for optimal maternal and fetal health during pregnancy. It regulates placental growth, hormone production, and immune tolerance. It balances the immune system to prevent infection and reduce inflammation. It influences over 1,000 genes, including those involved in implantation, angiogenesis, and fetal organ development. It reduces the risk of gestational diabetes. It supports fetal bone development. It supports fetal brain development through anti-inflammatory and neuroprotective pathways. It plays a critical role in fetal lung development. Analysis paralysis. Let's get unstuck together. And what I mean by this is when you read a journal article, at the end of the article is the same catchphrase statement. More studies need to be conducted. There comes a point where there have been enough studies to at least show you that there is a positive role that vitamin D plays in maintaining a healthy pregnancy as well as in fetal development. We know that over 80% of pregnant women are estimated to be deficient in vitamin D. We also know that Black women are at really high risk of vitamin D deficiency due to our higher melanin content in the skin. And Black women also have the highest rates of pregnancy-related complications, including death. Vitamin D does play an important role in maintaining a healthy pregnancy as well as setting the foundation for optimal health in the fetus. Based upon randomized controlled trial data as well as observational data, let's just ensure that all women maintain a vitamin D level of at least 40 nanograms per milliliter, which has been shown to have the lowest rates of complications from pregnancy. And we can do this through testing, supplementation, and safe sun exposure. Thank you.